everyone. This is Molly, the Kush RN, and you've reached Conversations with Kush podcast. Tonight, I have two incredible guests coming all the way from Trenton, New Jersey, Mr. Gaetano Lardieri and Ms. Nichelle Santos from Canna Coverage. .net. They're going to talk to you about some really innovative things that they're doing in the insurance space. So welcome.
Great to be on the show today, Molly. I'm Nichelle Santos, founder and CEO of Canna Coverage, and we are a national insurance brokerage and consulting firm contributing to the success of a safe and legal cannabis industry with compliance and risk management strategies and a full portfolio of insurance services. We bring solutions to mitigate risks, protect businesses from failure, increase revenue to cannabis businesses and tax revenue to communities, as well as maintain public health and safety to impact and uplift the community and the environment. What we're really excited about is the opportunity to transform healthcare with medical cannabis as an employee health benefit.
Yes.
Through group health plans, we can scale patient access and affordability, as well as attract new patients to the industry that may never have tried any modality of cannabis. And this innovation is an alternative to opioids and other addictive prescription drugs that have a high overdose rate, or those that cause harmful adverse effects, as well as bringing cost savings to healthcare spend. So it has many features and benefits with medical cannabis as an employee health benefit now available to both public and private sectors across the country.
Right. And a lot of times, Nichelle, let's just remind folks that cannabis is sometimes the only thing that's helping people, that it's the only thing that's working for them. They've gone through the gamut of trying different things, and cannabis is the thing that clicks and that works. So, this may be the only way that they can access their medication in an affordable way. So tell me how that happens exactly. So you are an insurance business, but this product is like almost an employee benefit, or not almost, it is an employee benefit.
It's integral to employee health benefits. So it's new, it's innovational, and it's time that we transform healthcare with alternatives, not just medical cannabis, but also ketamine-assisted therapy, psychedelics-assisted therapy, and Gaetano Lardieri is certainly the expert in ketamine, and we like to call it CAT and PAT. So we have medical cannabis, CAT and PAT. It's time to take this industry to the next level, right? Because as cannabis business owners have had to think outside the box and to be really resilient and persistent to establish their businesses, now we have to go back and bring cannabis along, take it to the next level by bringing medical cannabis on board. That's how you scale patient access, patient affordability. You bring in patients that would have never tried cannabis ever. Right. So it really boosts cannabis sales, tax revenue to the state and local municipalities, improving health outcomes. So we're incorporating the healthcare carrier community. And now when you do implement medical cannabis as a benefit, when you go to get your medical cannabis card, we're using a telehealth platform to make it really easy and convenient. And the patient only has to pay their copay, just like they're going to any other wellness visit. So we're incorporating an insurance term that we call the third-party administrators, the TPAs, that pay the doctors, like charge the employer, pay the doctors. And the employee, the patient, only pays their copay. Now you have your medical card, and you can visit or shop at the dispensaries that are in the network, just like you have to see your doctor in network or your pharmacy in network. And there you get that 20 to 25% discount, which is impactful. And like in the state of New Jersey, there's no sales tax. So that becomes really a meaningful discount because we believe the patient shouldn't have to pay out of their pocket for their medicine. But so you get that discount until such time, good folks like Gaetano and myself and Minorities for Medical Marijuana, the Coalition of Medical Marijuana of New Jersey, many other organizations across the country are advocating for the healthcare carriers to reimburse for medical cannabis. And it's really a game changer. So
nice.
Yeah.
It's so almost like
we're making history.
Yes, you are. This is incredible. I've never heard of this before. And
first
it is really
Jersey, and first in the nation.
Exactly. It's groundbreaking. You guys, it's incredible. Honestly, thank you so much for this work because, how do you even take this on? First of all, you have to break through all these stigmas. Then you have to break through the gap in knowledge by providers and patients. And you have to, kind of navigate that whole system. And I think really the crux of it is the stigmatization, right? Like people are like, what? Cannabis is a drug. It's not medicine, so getting people to really view cannabis as medicine is like, got to be where you start at the ground level. But what I love about this is that you're almost vertically integrated. You bring the patient in, you give them a telehealth visit, they get certified in their card, and then you guide them as to where they can shop. Are the providers recommending like dosages or like who is doing that education to like the new consumer of cannabis? Like how do they know where to go from there?
Yeah, the doctors are very well. These are cannabis doctors, so they're well educated on strains, terpenes, over 70 medical conditions and illnesses that are impacted by medical cannabis. So they have that conversation to make those recommendations. Then the patient is sent to one of those dispensaries in the network, and that dispensary has been trained. Their bud tenders are very well trained to understand strains, terpenes, conditions, what works best with that patient, their condition, their cannabinoid system, to really help improve the health outcomes of the patient and provide that alternative, right? It's time to do away with these poison synthetic drugs that have really ravaged our communities and, cause problems in the workforce.
Right.
It costs the workforce billions of dollars with lost work time, high turnover of employees. You have to hire someone new, onboard them, train them. So it's billions of dollars that have been lost to the opioid epidemic.
Sure.
So
how do you
medical cannabis is the path forward.
Agreed, 100%. How do you sell this to employers?
Well, the Canna Coverage team, Canna Coverage was founded by myself and Jeff Booker. Gaetano is also an advisory board member, again, bringing that expertise to psychedelics and ketamine. Our background is from the public sector, providing insurance, risk management, health benefits to municipalities, to counties, to school boards, and advising them on, their drug formulary, their health plan design, bringing cost-saving strategies. So when we talk about, opioids and what it's done and medical cannabis, it's a plant.
Yeah.
And folks really understand the medicinal benefits. And so we were able to bring this to the city of Trenton. And what was magic about this city, Mayor Reed Gascoria, he's a former assemblyman that helped to legalize the medical market back in 2012.
Okay.
So he went from assemblyman to mayor and led the charge with this fight. So now he's the mayor, and we come to him and say, hey, we're offering this as a medical benefit. And he got it right away. He understands the medicinal benefits and the cost-saving strategies to the workforce and to the taxpayers. So then other cities, the Orange Board of Ed, Teaneck Board of Ed. So it's so exciting that we now have police officers, fire personnel, and teachers that have access to medical cannabis. It's really incredible.
Thank you so much.
Molly, you asked something a little earlier, and it hit me about how do you break the stigma. And to be honest with you, I've been in this space for 11 years. I've talked at hundreds and hundreds of events and attended hundreds of events. So I've broken the stigma. And Nichelle's been in the business. We're all over New Jersey and New York and Pennsylvania. So we've already kind of broken that stigma by being there and talking to people and leveraging our connections to bring all this unique ecosystem together.
Yeah. I guess maybe I didn't phrase my question well. So what I was getting at is I think about the system that I work in, and it's pretty much like a zero tolerance policy on cannabis. So we don't allow people to access their medication while they're in the hospital. We don't have any providers really with tons of knowledge about cannabis. We don't have any nurses, specialty nurses, cannabis nurses that people can go to for guidance. It's pretty much you get your card in Minnesota. So I'm thinking about how your program could apply to somewhere else, right? So you get your card in Minnesota and you go to the medical dispensary, you speak with a pharmacist, they do that education piece for you, they recommend a product, you try it out, and then you just kind of trial and error your way to the place where you want to be, right? I have such a bigger vision for cannabis where I would love to be seeing nurses doing that education and just really guiding patients through that whole process. Getting back to my point, though, is that the place where I work at, it's zero tolerance. So we know that helping professionals like police officers, like firefighters, like nurses, like teachers, people in helping professions need to be able to access cannabis. How do we let companies or businesses or, police departments and, hospital systems hey, the people that actually work for you need this. And so how can we help them access that? And are you open to that? And how do you open up their hearts and minds?
Yeah, I'll say it was the perfect storm in New Jersey. We also had on board the state attorney general.
That's nice.
On the guidelines and the protocol for emergency personnel to be able to consume.
Yeah.
And the guideline came down to you can't consume 8 hours prior to your shift.
I love it.
And there's some self-policing
for sure,
that, unintended,
right.
Understanding how your body reacts to dosages.
100%. I love that. I love that there's actual, is it through legislation then that this is done, or is it just, you said guidelines? So where?
Yeah, that's the state attorney general guidelines.
Yeah, these need to be in every single state.
Yeah,
they really do. So I just want to stress again, this is so incredible. This is really groundbreaking. And I hope that this spreads like wildfire to the rest of the nation.
And that's why we're on your podcast. So hopefully we can bring it to other states as well, Molly,
Yeah, I want to hear for sure. Guy, let's hear a little bit more from you. I know that you're really into the ethogenic medicine. So how do we overcome these challenges of them not being legal, where I feel like some people think, well, psilocybins, we're so much further ahead in research and, than we are in cannabis. But I think there's still quite a stigma about psilocybins, and how do we combat that and let people know this is actually medicine for people?
Yeah. So actually, there's quite less stigma with the psychedelics than there is with cannabis. I run into more stigma with cannabis than I do when I start talking about psychedelics with the psilocybin and the ketamine. So first of all, ketamine is, as you already probably know, is a dissociative anesthetic.
Right.
And it's FDA approved drug. Now it's used off label very successfully, I might add, to treat things, conditions like PTSD, anxiety, and depression. So there's a little bit easier lift when you're talking to employers, employees, and other people that need these compounds about these medicines. So there's less stigma to deal with in that respect. But it all starts with education.
Mm-hmm.
It all starts with education, educating the professionals, educating the consumer. So it definitely all starts with education. But the lift is easier, at least I found, and Nichelle can back me up on this as well, when you're talking about compounds that are going through clinical trials, FDA approval, when you're establishing a safety and efficacy, just like a regular drug going through the trials and so on.
Right.
So it's an easier lift in that respect.
Okay.
Less stigma, as far as I see.
Okay. Because I would think that, well, and these are just assumptions, okay? This is just my lack of knowledge. I would think that there would be even less or even a greater gap on like psilocybins and ketamine. And I know that there's like ketamine-assisted therapies, clinics that you can go to, but they just, like, you just don't see that kind of stuff in the hospital. I guess I'm always thinking about like it from a hospital perspective, like what am I going to see in the hospital? So it's interesting to me. Like, what are some of the pushbacks that you get from people? Like, no, we don't want that. Those are drugs. Like, what do you hear from people? What are their questions about it?
It depends on the professionals. You hear, well, that's not FDA approved yet. You get that mostly. And actually, if you look in clinicaltrials.gov, which is the go-to database for all the pharmaceutical companies that are developing drugs, if you look under psilocybin, there's over 100 clinical trials in phase 2, which is right before phase 3, before you get approval and so on, that are there for all kinds of indications, chronic and acute conditions with psilocybin. Mm-hmm. So these drugs are all going through those clinical trials. So that's what you get from the professionals. It's not FDA approved, or I can't prescribe it, right? Because they can't write a script. Like take one PID 3 times, whatever. So the doctors don't have control, and they like control, right?
Yes.
So eventually, when they get approved, these compounds get approved, and we just had a big setback with MDMA through MAPS not being approved, but they might have a second stab at it for phase 3 and so on. So that's what the pushback is on the clinical side with the physicians and so on. They can't write a script. It's not FDA approved drug yet. Yeah.
I know when we spoke earlier, Gaetano, you talked about reaching out to big organizations, especially unions, to try to get those things implemented for a large group of, folks, whether it be, I don't know, like Teamsters or whatever unions might exist. So talk a little bit more about that.
Yeah, so actually there are several unions here in New Jersey that are already pro-cannabis unions. Actually, one union is very active in unionizing the bud tenders. And again, Nichelle and I, Canna Coverage, we have very good relationships from being in this space many years and going to events and so on. And we just use those connections and leverage them to have conversations. And it takes multiple touch points in conversations. But we've had now some very serious conversations with major unions that have in the tens of thousands of employees and in the millions in the nation. And we got to have those series of conversations. That's where I bring in Nichelle and Jeff and Canna Coverage as the experts in insurance. And then they have that conversation on the back end to the HR benefits manager. And Nichelle can explain how that all works. But we leverage our connections to we leverage our knowing different people to bring these together, and then we just pull it all together. It's very unique because you have to have insurance experts, you have to have the connections, you have to have the science expertise. So all of this comes together to actually make this historic events happen.
Sure. Nichelle, how do you present it when you're looking at big systems to try to implement this program? How do you present it to the HR people and the risk management people? Do you say like it's a cost savings? Does it cost them much money to do this?
Yeah, I mean, what I wanted to say in response to Gaetano is it takes a village to raise up a safe, legal, productive, viable cannabis industry, and we love our unions because they're helping to build the workforce.
Absolutely.
And they're bringing a workforce that's prepared and trained, and it makes it easier for the cannabis operators. They already understand the importance of employee health benefits because they offer that to union members, which helps to improve the culture because they're happy, they're healthy, they're taken care of, their families have benefits. Right. And so we approach them just like any other line of healthcare coverage. You have your medical coverage, your prescription, your dental, your vision. And this is just an additional line of coverage, medical cannabis benefits. And because they work in the industry, they're trained on the medicinal benefits. They get it. Right. So if they can make that available as a health benefit, as well as ketamine, CAT and PAT therapy, again, they've had to think outside the box in providing this training in an industry that's still federally illegal, but legal in certain states. So we're all thinking outside the box. So bringing these alternative treatments falls in line with their frame of thinking.
I'd love to see the metrics on the decrease in SSRIs, in pain medications, in things that are commonly used adjunctly with cancer, like Zofran or antiemetics. I would love to see the metrics on that. When cannabis is introduced into these spaces, how much do the other pharmaceuticals go down? The use of other pharmaceuticals go down? And
we will be measuring that.
Yeah, because cannabis.
I worry that it could almost sometimes be a hindrance in your field, though, as you're trying to roll these out to other people. Like maybe some people are still invested in supporting big pharma. So,
so there, we will be measuring these. Actually, we might even partner with the university. I have one colleague that's a professor that might be interested in partnering and doing a study with the unions. But just to give you want to hear some metrics, and I think I shared this with you, Molly. One of the articles. There's a case study with Dr. Bronner's soap. I don't know if you know, but Dr. Bronner is famous for about 100 years with making organic soaps, but he offered ketamine-assisted therapy to his employees. I think 7% of the employees took advantage of that employee benefit service, and they had 86% improvement in post-traumatic stress disorder, 67% improvement in major depressive disorder, and 65% improvement in general anxiety disorder. And then after 1 year, they had 82% of the people reported that they're no longer taking antidepressants.
Incredible.
So there's a case study for you. So the potential is that if you bring on this as an employee benefit, the ketamine-assisted therapy, your employees potentially can have those same results. That's a great case study that we use in our talks to educate.
Well, and that just trickles down, right? You have less call-offs, you have a higher, less attrition in your workforce. So you're not losing people, due to certain things. It's just like an overall happiness of, working for a company that supports people's mental health and mental well-being. So
And we have some data on the classification of drugs that can be replaced with medical cannabis, like anticonvulsants, glaucoma, anti-migraine medications, ADD and ADHD medication, sleep medications, antipsychotics, obviously opioid medication and muscle relaxers, medicated skin ointments replaced with topicals.
Absolutely.
Topicals, arthritis, anxiety, and antidepressants. And then we have an actual case study with one of the board members of our business partners. And her name is Anne. And Anne was diagnosed with MS back in 2013. And she was prescribed, the traditional drug, which is Copaxone. And this was back in 2013.
Mm-hmm.
And Axon costs at that time about $7,100 a month for her prescription.
Mm-hmm.
And along with being prescribed that drug, her doctor knew that they had to continue to monitor her kidney, her heart, and liver for adverse impact,
right,
so that they could prescribe that cocktail of drugs to counteract the adverse reactions of her kidney, heart, and liver,
right,
which we know very often leads to that downward spiral
mm-hmm.
of her health condition. So instead, she chose to go with medical cannabis and came up with a recommended prescription that costs approximately, let's say, $1,000 a month, is under $1,000. And so that's back in 2013, and it's 2025. Anne is functioning. She still works as a cannabis law attorney. She has a high quality of life, and the cost savings to the health plan is over $1 million, which doesn't even include, there's the iceberg theory, the costs that you can see, and then all the hidden costs. But the fact that her health has improved, it's a fantastic case study, and that's one of the things that we present to the HR manager or to the union.
Right.
Back to your question earlier, providing real evidence-based studies and to let the data tell the story.
There's got to be thousands more examples too, yes. Nichelle, right?
Yeah.
It just needs to be uncovered, essentially. Yeah, I know several people that use cannabis for MS and with really good results, Why can't we as healthcare consumers, because that's what we are a widget when we access our healthcare, why can't we choose what we want to pay, what we want to treat ourselves with, or what works for us, right? Like, we should have a say on that. I always advocate for patients by saying, this is what the doctor recommends. If you don't think that works for you, or you'd like to try something different, you can always say that. So I think
my body, my choice.
Exactly.
So, but folks have to be educated. They have to understand that they have cannabis, pat, as a resource, as an alternative, and the ability to make choices for themselves and for their families.
Right.
So we're really excited to be part of this historic movement.
Mm-hmm.
And we're, like I said, we're here to transform healthcare. It's time. It's long overdue.
Long overdue. This is such so out of the box thinking. And how do we get this from Trenton, New Jersey now to St. Paul, Minnesota?
Yeah, I mean, Gaetano and I are.
It's mine. I would love to do it. Honestly.
Yeah, we're also part of other organizations like the National Cannabis Industry Association, Minorities for Medical Marijuana, that also endorse what we're doing, and we can share legislation. We can come up there and speak. I've actually met your attorney general at a conference a couple of years ago, and
Keith,
and had a conversation. So folks are changing their frame of thinking.
Absolutely.
And now that we have this one attorney general in New Jersey that made this change, it sets precedents.
Yeah.
So we have to share this information so we can replicate in all these other states that have already legalized.
Right. Here's one way that I think
we love doing panels, Molly.
Well, you have full use of my platform at any time you want. Right. I will tell you that. Here's one way I think that we can get people to get on board is I think we need patients to ask, hey, I've heard about this great thing that they're doing out in Trenton, New Jersey. Why can't we have that here? or calling up Keith Ellison's office and saying, hey, I heard about this great program that they're doing out in Trenton, New Jersey, and I think that we should really have this in Minnesota. So it's people that are using cannabis that know that it works for them. That's maybe the only thing that works for them. Or I'm sorry, ketamine, PAT or CAT, that they find beneficial, and saying, we need these alternative therapies because the other things don't work for us. And so people, please raise up your voices to your employers, to your legislators, to your lawmakers, and let's make this happen across the nation. Like, this is really groundbreaking, as you said, Nichelle.
Molly, you know what you can do? Take the article that was written up and just blast it out, and have all your constituents send it to their legislators and say, here, look, this is what they did in New Jersey. Contact Canna Coverage, contact us,
Yeah. Nice. I love it.
Yeah.
We talked a little bit about what cannabis can do. We talked a little bit about what ketamine can do. What are people using psilocybins for, Guy?
Oh, a whole host of things. As you know, out in Oregon, they were the first to establish the psilocybin service centers, and they've been up and running about a year. So we have some data we can look at from there to learn from there. And Colorado now has started in 2025. I believe they're starting to see patients initially in the psilocybin service centers. And New Jersey has a magic mushroom bill, a psilocybin service center bill, S2283. So, and they're using it for PTSD, anxiety, depression, a whole host of acute and chronic conditions. So yes, stay tuned for New Jersey, and let's see what Colorado does, but very successfully for lots of conditions. And again, you can look in clintrials.gov, and there's well over 100 studies in phase 2 for all kinds of different conditions for using psilocybin.
Yeah, and I guess this is why I say, like, in my opinion, I feel like psilocybins aren't as far along as cannabis, because we have medical cannabis in many, many states, right? Not in every one, but we only have psilocybins in a couple, right? So that needs to expand. If we've got all this great research and we know all the great things it can do for people, why aren't we opening this up? And, in Minnesota, we have decriminalized it in Minneapolis, but that's one city. And it doesn't mean that you can't go to jail for it. It just means that they're not going to be like knocking down your door for it, or, charging you with an extra charge if they catch you with it. So,
and you got to remember, Molly, so these are service centers where you go and you get a treatment, right?
Gotcha.
So that it's different. You don't go to an ATC, get your medicine and go home. It's a little different, a more of a medical oriented model.
Gotcha.
And don't forget, these are businesses, right? So they have to be profitable too. So people have to set these up, and there's a lot of red tape, a lot of guidelines and regulations. So it's not an easy business to get into.
Tell me, both of you, what else do you want my audience to know about this great program that you're working?
Yeah, I would say that it's really fantastic, and it's groundbreaking that the public sector has accepted medical cannabis as a benefit. And we're so excited over the energy that we're receiving. Canna Coverage was announced as cannabis brokerage firm of the year by Cannabis Business Insights for 2024 and 25.
Congratulations.
Thank you.
Yes.
Super excited.
Yeah.
And our team's done a terrific job. What we want the audience to take away, because we know you also have an audience of cannabis business owners.
Exactly.
We want the cannabis business owners to also engage in, of course, call us for your employee health benefits. That's what we provide. But adding medical cannabis to their existing benefits gives us the opportunity to walk it like we talk it. Right? You're in the cannabis industry because you believe in the magic of the plant.
Every single cannabis business should have this. Every single one across the nation.
They should lead.
Time to lean in.
Absolutely.
Lean in.
Lean in.
And that way we also get access to the data, right?
Yes.
Why are people utilizing cannabis? What modality are they using? What's their experience with strains and terpenes? what's the health outcome, what prescription drug was replaced. That's valuable data.
Absolutely.
And Gaetano says something that I love, trust God, but all others bring data. So having that data is so incredibly valuable, and it gives us the opportunity to tell the story, not just about this one patient, but millions, hundreds of thousands and eventually millions of patients across the country. And that also helps to remove that stigma. We were sold a bill of goods about why cannabis was oppressed, that it was the devil's lettuce,
right,
and all the horrible things, and it led to mass incarceration for Black and brown people.
Exactly.
It was weaponized against these communities. Now we flip the record over. You guys know what a record is anymore. You flip it over to the B side, and now we've gone from criminalization to commercialization.
Exactly.
So what can commercialization represent? It represents the medical community and the adult use. And we see the adult use market taken off, but let's not leave the patient behind. It's critically important that we keep patients first, because that's what got us to this point. So that pendulum, it was on the medical side and now it's on the adult use side. So how do we find that balance?
And I'll take it a step further, because I don't delineate between adult rec use and medical cannabis use. I understand that the dosages might be different, but as a patient that uses cannabis, we're all accessing our medication.
It's all medical.
Yeah, right?
Yeah, and just to add to that, call your legislators, right? So the hard work has sort of been done, but there's still hard work ahead of us. I mean, I say, I'm an 11-year overnight success kind of a thing, right? So it didn't happen until 11 years later, but it happened. Canna Coverage, Nichelle and I, we did the work. It's there. Take that article, send it to your legislators. Say, hey, look, New Jersey did it. Let's do it here. Yeah. Very simple.
And we will link that. We will link that article in our show when it airs, so that people will be able to have quick access to that and be able to. We also will link the information how to contact your legislator, so that you can forward that right along to them.
Smart. Yeah.
One other thing I just want to ask about, because I think I feel a responsibility working at the bedside to always make sure that cannabis is being brought to the forefront, that it's being viewed as medicine, not as something illicit. So what types of, as providers, as clinicians, as bedside healthcare workers, what can we do to support the documentation that people are using cannabis and that it's working well for them? Like, what kinds of diagnoses codes do we need to be getting into people's charts, so that other insurance companies will start to begin to recognize that, yeah, this is medicine, and we might need to be doing more for our patients than just telling them they can't use it?
So just maybe I'll take a little piece of that.
Yeah.
Because nurses. So first of all, I love nurses, because they taught me everything I know. I worked at a hospital for 15 years, and I learned everything from my nurses. Right. So they're my first love in the industry there. But so nurses do education.
Yep.
Constantly doing education. So maybe you can use a CPT code where you said, I educated the patient on alternative medicines or alternative choices, or some type of education. So that's what I would suggest, because you can't do too much right now. And I know you got to think about your charting and so on, and chart judiciously. But I would say you find an education code and work around that. That's would be my advice, I think. Okay, great. How about providers, people that can actually prescribe medications? Is there diagnoses codes that they could bring forward, or, like cannabis without adverse effect, or I don't know, there's a few of them out there. Do you guys have any specifics on those, or? Yeah, we're still in the early stages. Okay. So it's always a recommendation. Sure. As opposed to a prescription. Okay. But there are a lot of codes, and I can send them to you afterwards for ketamine therapy, right? So
Okay.
ketamine is free. There's different codes that I think physicians use for that. So and that's the other powerful thing behind the psychedelics, because once you start getting them FDA approved, then they come with the CPT codes, insurance reimbursements, and so on. So that's powerful there.
I think one of the other things that we can ask of patients and as healthcare consumers is that you have control over what goes into your chart. So instead of, if a patient says, the doctors will ask you, do you use any drugs? Or sometimes nurses will ask you, do you use any drugs? Do you have any drugs on you? Instead of saying like, well, I do use I don't use drugs, but I do use medical cannabis. So I think the way you word things, you also as a patient have charge over what goes into your chart. If you tell your doctor, I use cannabis because that is the thing that helps me sleep at night, and I want you to document that, they have to document it that way.
They have to legally document it.
Exactly.
Yeah.
And so I think there's a lot of work that needs to be done on a patient education side as far as like what you actually have charge of. Like the healthcare system is not in charge of you. You are in charge of them. You uphold the healthcare system. You are literally the thing that holds it together, right? So I think, again, just educating the patient as to like what they're responsible for and how they can affect change is very important. So.
Yeah, because if you go to another doctor and that doctor sees that you're a user,
exactly,
it has that stigma.
Exactly.
It's medical cannabis. It's a plant.
Yeah,
you're not a drug addict.
Exactly.
So we're still looking to alleviate and dispose of that stigma, but we have a long way to go.
We do.
And we need to establish, cannabis guidelines and dosing. And this is a good thing about rescheduling to Schedule 3, because once that happens, then the federal government has to come up with standards and guidelines and dosing, right? So that they have to, right?
Yeah.
So that's, and then also too, professionals can design and come up with a protocol how to deliver that medicine in a hospital. Like, does it go to the pharmacy? Does the charge nurse dispense it, or the medication nurse dispense it? How is it dispensed? Does it go in the drawer? That whole protocol could be written and you have some standards.
Yeah, we do.
Standards.
We do need those standards. And I was really happy to hear you guys talk about that. And I think that is one thing that I will be lobbying for when my legislative session opens up. I will be down there every single day banging that drum. Like, we need these.
Standards and language is important. Like you were saying earlier, Molly, the language is important too. Make sure the language is consistent as well. Yeah.
Nice. Oh my gosh, you guys, it just warms my heart to see what you're doing. Like, truly, this is incredible. I had never heard of anything like this before. When I saw you, Gaetano, on Mo's.
LinkedIn.
Yeah.
LinkedIn.
No,
I love LinkedIn.
We talked at Cannabis Public School. Mo Smith out in Northern California is doing Cannabis Public School, and like, man, it was like kismet when I saw what you're doing, and I was like, holy shit. Sorry. Like, this is, like you said, it's groundbreaking.
And that's the other thing too. I mean, pre-COVID, I was at every single event I could possibly attend, from Pennsylvania to New Jersey to New York and DC, and just go. And COVID hit. I said, oh my God, what am I going to do? This is crazy. But you know what? After that, Zoom exploded, and I think I'm up to 33,000 connections on LinkedIn.
Nice.
Zoom. So just Zoom, talk to people. I never say no to anyone. I'll talk to anyone, everywhere, anytime. Take calls 12 o'clock at night. It's fine. But just put yourself out there.
Yeah.
I mentor lots of young people. And I say, you got to show up, show your face, talk to people, let people know who you are. A lead might not work out for a year later, but I have had that happen too.
Yeah.
Very important.
The other thing that I love about this is that it supports, again, the helping professional. So people that are working in jobs typically where you're like, oh, okay, they use cannabis. Like, how many years did I go not accessing the medication that works for me because I was so worried about, upholding my position as a nurse and making sure that I was responsible. And, all those years clinically depressed, where I could have been functioning at a way higher level than I did, and I can't get those years back, but like so grateful that I found cannabis and that I was able to
your patients better too, if you're able to, right?
100%.
Yeah.
And
there's so many professions that are exposed to trauma, nurses, doctors, EMT, police, fire, and not having access, the opioids and other drugs that have those adverse effects, are not the answer.
Right. Because what do we see? What do we see in helping professionals? We see the highest rates of alcoholism. We see the highest rates of divorce. We see the highest rates of suicide. I mean, these are real tangible things that could be easily remedied if we could break that stigma down and allow people to access the medication that works for them. So
lots of burnout. And and this is interesting. Here's another thing. All those medical professionals, they're burning out. They can go into this as a business too. So take
100%.
that to the bank. A nurse or a doctor or a nurse practitioner set up a ketamine clinic or so. Just get away from that and go into something that you can really, really help people. Yeah.
My vision for it, again, and I hope that maybe you guys will take this back to your team, is using nurses as the educators, as the person that's helping guide someone through that whole process of like finding that special place where they need to be with cannabis or ketamine or psilocybins, whatever that is. So our profession has done a great job. I think this year we will come out with a test for certification so that we will be recognized as a specialty now. We actually already are. We just don't have the test for certification quite rolled out. But, recognize that they are people like me and other cannabis nurses that can help guide people and curate products and lobby legislators and have podcast platforms to destigmatize cannabis. Like, we're out here. So
there's Molly, there's a whole profession too, for nurses and for people who are not nurses, but as trip sitters.
Yeah.
Fantastic profession where you facilitate a psilocybin session or a ketamine session. So trip sitters, look into that. Have your constituents look into that too as well. Trip sitter is a fantastic profession.
Great point. And I 100% agree because that's needed too,
Yes.
Yeah. Thank you guys. Anything else that you want to say and make sure that my audience is aware of before I let you guys move on with your day?
Yeah, I just say the cannabis industry is a plethora of opportunity, opportunity for workforce development, for innovation and science, transforming healthcare. Bring your expertise to the cannabis industry because it's an emerging market. It needs everything. So help us transform healthcare. Get educated on medical cannabis, cat and pat, spread the good word, just like the gospel. And what you said, Molly, you're in charge of your body, your choice, what you put in your body, what goes in your chart. It's time for people to raise their frame of thinking to a higher level, no pun intended. But you are in control. And then you also have a voice with to advocate with legislators.
Absolutely,
the time is now to make this change.
Yeah, so empowering.
Just to echo what Nichelle said, definitely follow up with your legislators. Send the articles. Clintrials.gov. Follow if you're really into the clinical research and so on. That's the database of the go-to database for pharmaceutical companies. They are entering their clinical trials there. And just follow. You can follow that as well. But contact the legislators and tell them you want this, and then give us a call and we'll show up.
Yeah, immediately. Tell my audience where they can find you.
Yeah, absolutely. You can find us at www.cannacoverage.net and Nichelle Santos on LinkedIn. We're on Instagram, Nichelle M. Santos, and Canna Coverage on Instagram. So it's really easy to find us.
follow me on LinkedIn. I'm at the max, but I can have followers at this point now. I'm over 35,000 or 33,000, and I post prolifically on LinkedIn. I have professors that come up to me and say, "Oh, I used your article to teach my class." And
awesome.
I get stuff like I get stuff on the cutting edge because I'm connected with all these different professors that are doing research and they're colleagues of mine and so on. So I'll get something a little earlier than the general public. And I post it. So definitely follow me on LinkedIn.
Yes, please
Gaetano
do.
Lardieri on LinkedIn.
There we go.
Nichelle Santos on LinkedIn.
Thank you, guys. Thank you so much for this work that you're doing. And please let me know what I can do to help spread this like throughout the entire nation, because I will go on a campaign immediately.
Nice.
Yeah.
That's what needs to happen. So we appreciate you so much, Molly, for having us on the show. The Kush Nurse.
Thank you, guys. My ask tonight of my audience is to make sure that you check out the links that are attached to the show and lobby your legislators. I will attach both the article that Gaetano has referenced, along with how to contact the legislator that applies to you and where you live, to make that an easy and smooth transition. We'll see. I might even craft a letter that can attach to that legislator. And because let's make it easy, and let's let the people that are making the laws that ultimately come down and apply to us work for us. Like, that is what they do. Those people work for us. We elect them. So they are our civil servants. And I just want to follow up by saying, make sure you go ahead and do that. And also like, share, comment, and subscribe on all platforms, all audio platforms, including Spotify and Apple, and my YouTube channel at Conversations with Kush. And I am Molly the Kush RN signing off. Thank you, everyone.